60 to 90% of performance horses have ulcers. What this means is that if your horse hasn't had ulcers in the past, he either has ulcers now or is going to get ulcers. And really, that's just how it is. So many horses are undiagnosed with ulcers. I wanted to talk about some of the myths that go on in barns regarding ulcers. For some reason, people really go into denial when you talk with them about the possibility of their horse having ulcers. I have seen people have their horse's entire neck x-rayed, do an entire lameness exam, have an MRI done on front feet that weren't lame. They've pulled them out of training. They've changed disciplines, all to avoid the diagnosis of ulcers. And in the end, all of those horses ended up being scoped and having ulcers. Once they were treated with the proper medication, their ulcers went away as well as the behavior. Some of the myths that are going around about ulcers is that if your horse had ulcers in the past and you give them this potion or this powder, or you free choice their hay, or you keep them on this medication, that they will never have ulcers again. That is absolutely incorrect. I have seen that scenario end up with ulcers in more than one circumstance. We also hear about preventing ulcers by giving them Gastrogard before traveling, during competitions, and weaning them off of the Gastrogard once they go home, keeping free choice hay in front of them, turning them out as much as possible, trying not to overwork them. There's this big long list of things that you can do to prevent ulcers. I actually currently have a horse in the barn who has the absolute perfect life for never having ulcers, and he was just scoped with ulcers for a second time in the last year. So I think some horses are either predisposed genetically to having ulcers, or we're just missing some of the signs that these horses actually have ulcers. When we read about the symptoms of ulcers, I think a lot of us are either in denial about our horse exhibiting these symptoms, or in our head we're seeing a more extreme as being what this symptom is. When we hear the horse is girthy, in my head, I think the horse is biting, wringing their tail, kicking out, or if you tighten the girth, they start bucking. Girthy doesn't have to be that bad. A horse that is acting out that much at the girth is a horse that hasn't been listened to for such a long time. They're having to shout at their people. Girthiness can be something simple, like the horse stands really nicely in the cross ties, and when you go to put the saddle pad on, the horse walks all the way up to the end of the cross ties and puts pressure on the cross ties. The horse could also just start swishing their tail lightly from side to side as you start to do the girth. Another symptom I've seen with girthiness is the horse kind of blanks out in their eye. They stare into the distance while you are doing the girth. Once the girth is snug, their expression and their attention to their handler comes back. I think those are the girthy horses that are often overlooked, and if we get to them sooner, we may be able to help them be comfortable without having to medicate them for so long. Another one that we hear about is horses that are difficult to ride. Well, that could be just a horse that's actually really good to ride as long as you only ride them for 30 minutes. If you ride longer than 30 minutes, their work ethic goes away. That could just be that they've had enough acid splashing in their stomach that they're now very painful and not able to continue working as they did at the beginning of their ride. Difficult to ride could also be something like they spook in the same corner every time you ride them. They're using that area of the arena to get their focus off of what's going on inside the arena, which is uncomfortable for them. So we really have to look at our horses and look at those subtle clues to see what's going on. Some other things that I've seen that I don't see mentioned in all of the articles discussing ulcers is something like tail not growing and hooves not growing. A lot of these horses that I'm seeing with ulcers, they're going 8, 9, or even 10 weeks on their shoeing, and very little is being trimmed off. So I believe that when horses have ulcers, they're not absorbing their food properly. That's where we hear a lot about horses being difficult to keep weight on, although I've had a lot of really fat horses come into the barn that have had ulcers. Also horses with beautiful shiny coats, and the owner is saying, there's no way my horse has ulcers. Look how beautiful my horse's coat is. Look how fat my horse is. Look how shiny my horse is. And that horse had some pretty bad ulcers. So let's talk a little bit about ulcers and the medication. There's more than just one type of ulcer out there. When we talk about Gastrogard, which is known, proven drug that will reduce acid in the stomach so that if there are ulcers, those ulcers can heal. Going back to those myths, I have heard people say, I gave my horse Gastrogard for 5 days, 7 days, 10 days. It didn't change my horse's behavior. He must not have ulcers. Gastrogard is designed to reduce the acid in the stomach. That is all it does. Then the body has to heal the ulcers that are there. A product called sucralfate is really good at putting a Band-Aid over the ulcers so that the body can heal by not having more acid splashing on top of the stomach. So Gastrogard and sucralfate are very good combinations together. Speaking of Gastrogard, there's another product also made by Marielle called Ulcergard. 1 tube of Ulcergard is the exact same medication as 1 tube of Gastrogard. They are just labeled differently because Gastrogard is an FDA approved drug to treat and heal ulcers. And so it had a patent on it for that. The patent has since run out, but because of that, when they came out with a new syringe for helping to prevent ulcers, they had to name the product a little bit differently. But 1 tube of Gastrogard is identical to 1 full tube of Ulcergard. So those can be interchanged. Sometimes insurance companies will want Gastrogard to be the product for treating and healing ulcers. We have another ulcer that a lot of people haven't heard about and don't really understand, and it's called pyloric ulcers. Those are ulcers that happen down in the stomach area that is supposed to have acid on it. So decreasing the acid in the stomach with a product like Gastrogard is not going to help those ulcers heal. They do much better with a product called misoprostol. Recently, the price has come down on misoprostol. You can also get a compound of it that is highly effective. And I don't usually advocate compounds, but in this case, the misoprostol has worked really well as a compound. So you do need to know what type of ulcer your horse has in order to treat it with the appropriate drug. I recommend that you always have a horse scoped if there's any suspicion that the horse has ulcers. Once the horse is scoped, you can treat the horse with the appropriate drug. You should then re-scope the horse at the vet's recommendation to make sure that that horse's stomach is clear of ulcers. When you do that, you can find out what the horse's normal behavior is like when they don't have pain in their stomach, so that when those symptoms start coming back, you know that you have to start retreating the horse again. In the perfect world, I think every horse should be scoped for ulcers at least once a year. It's just, we have so many ulcers going on that we really need to advocate for our horses and help them be as healthy and as comfortable as possible, especially with the demands that we put on them to perform for us. To go through a short little list that I have of symptoms that I have seen in horses that have been diagnosed with ulcers, and these symptoms we saw go away once we had a clean scope on the horses. Lack of top line, hay dunking, eating some grain, then a little hay, then going back to the grain, girthy, which could be any tension or bracing when putting the girth on, nervous and cross ties pre-ride, explosive partway through the ride or just for one movement, like a canter transition or a canter on a certain lead, usually it's the right lead, or something like a leg yield, kicking at the leg, lazy. A lot of times horses with ulcers really hold in their stomach and they don't move through their body. So they'll walk, oftentimes they won't walk out really well. So they'll walk super slow. They'll be a little dull to the leg and not want to go forward. And then that kind of also brings up inconsistent reactions to the aids, where sometimes they overreact to the leg and other times they underreact to the leg. And that can all happen in the matter of just a 20-meter circle. It can be that inconsistent. Panicking in the trailer, kicking in the trailer, difficulty bending, especially to the right side, falling out of the canter, traveling with the neck too low. A lot of times I'll see horses that you have to kind of shorten the reins and pick their neck up a little bit. And these aren't like quarter horses that were bred to be lower in the neck. These are warm bloods and Arabians, saddlebreds, hackneys, Morgans, horses that naturally have a higher neck set and they want to travel with their neck much lower than what conformationally they should be doing. Teeth grinding. Sometimes you'll only hear it when the horse is concentrating, and that's usually when their stomach is starting to bother them. Tail swishing when there aren't any bugs. A lot of times we'll see that at the end of a ride or when you put the girth on, the tail just starts going. Kicking at the stomach is another sign. Sullen look, especially after girthing. Sometimes they'll even park their neck, kind of stretch it out, and then just glaze over in the eyes. Not welcoming being caught or mounting. And that doesn't mean that they run away from you, but it might just be that when you go to their stall, if they happen to be at the back of the stall, they just stay there. They wait for you to get them because they don't want to do what you want them to do. They just don't feel good. Sitting like a dog. This is one I've seen a lot where a horse will roll and then they'll use their front legs and push their sternum up off of the ground and they'll sit there for a little while before they get all the way up. A lot of times that is stomach pain. Same as laying with their front legs forward, which again is kind of like how a dog would lay down where they're on their sternum, their front legs have come forward like they're getting ready to get up, but then they never actually get up. Being picky about hay. Horses that don't want to eat stems, it's probably irritating their stomach. Another weird one is horses can't belch. They can't burp. And sometimes they make this weird sound. I call it the whale noise. And they kind of do this, I can't even do it. But it sounds like a whale is all I can think of. And that's oftentimes related to stomach pain. hooves not growing. If your horse is at a 10, 11, 12-week schedule and the other horses of the barn are at a 6-week schedule, your horse isn't digesting their food properly. Something is wrong with the gut, and oftentimes that is your ulcers. Tail not growing is another one. They might have a big, thick, beautiful mane and no tail. Those are often ulcer horses, and these are all things that we have seen resolved once they have a clean scoping. I want to also point out that horses with insulin resistance, Cushing's, or allergies often are more likely to have ulcers. So that is something to really think about if your horse has any of those symptoms. I'm going to put them in the show notes so you can look back through them. And again, 60 to 90% of horses have ulcers. So try to really look at this list objectively and take your blinders off and try not to be in denial and say, does my horse seem to exhibit any of these symptoms? Because even just one of these symptoms can have ulcers. I've seen horses scoped with as many as 5 bleeding ulcers with only one symptom on this list. If you have any questions, you can leave them down in the comments, send me an email, or leave me a direct message. I will try to get to as many questions as possible. Take care, everyone.